Good morning and welcome to COVID-19 vaccine in Wisconsin, a clinician's view. My name is Melissa Lucarelli. I'm a family physician practicing in independent practice at Randolph Community Clinic in Randolph, Wisconsin. I was requested to make this recording by Dr. Jamie Deering, who is the Chief Medical Officer at Marshfield Medical Center in Beaver Dam, who asked me to reprise the short talk I gave to our medical staff this morning. Before I get started, I have no specific expertise in infectious disease. I don't work with or am not affiliated with the CDC or the Department of Health Services in Wisconsin. My intent is just to provide the information about the COVID-19 vaccine as I understand it today. Keep in mind as I speak that today's date is December 17th, 2020, and some of the information that I give today might be outdated or possibly even wrong. I will try to attach to this video some links to the agencies who are involved with the COVID-19 vaccine evaluation and distribution for your reference. Okay, let's get started. So the coronavirus disease, COVID-19 vaccine, that has been approved by emergency use authorization, and the second vaccine, which will hopefully be approved by EUA, by the FDA later today or even tomorrow. They're both mRNA LNP spike protein preservative-free vaccines. The Pfizer-BioNTech vaccine is a 2-dose series. This is the one that has already received EUA, given 3 weeks apart. It's 95% effective in the research studies. It requires an ultra cold, minus 90 degrees Fahrenheit transportation delivery. It can be kept up to 6 months at that temperature. It needs to be thawed and reconstituted. It can be 15 days in a shipper with dry ice and 5 days in the refrigerator once it's thawed. The Moderna vaccine, which has not yet been given the EUA, is also given 2 doses apart. 2 doses 4 weeks apart. It's 94.1% effective according to their research. It's able to stay in a standard freezer for up to 6 months, and it can be up to 30 days thawed in the refrigerator. It doesn't require reconstitution. It's already packaged, ready to go. The reason that these 2 vaccines have different storage requirements is how they're made. As I understand it, the Pfizer vaccine is a lipid emulsion, and the Moderna vaccine has microspheres of lipids around the mRNA, which is a very unstable product, which degrades quickly at room temperature. The vaccine is free. It's been purchased by the federal government and it's distributed to the states. But the providers who are administering the vaccine may charge an administration fee. There are some special administration codes that were just approved by the AMA. These are different than the usual vaccine admin codes. The code for Pfizer is 91300. The code for Moderna is 91301. Both of these vaccines will be indicated for ages 16 and higher. None of the vaccines, to my knowledge, that are even in the pipeline have been tested yet in a pediatric population. The Department of Health Services in Wisconsin says that there's no data on pregnant or breastfeeding patients in the phase 3 trials that have been published. But the vaccine should not be withheld from pregnant individuals who meet criteria for vaccination based on the ACIP recommended priority groups. COVID-19 vaccines should be offered to lactating individuals similar to non-lactating individuals, and this is consistent with the ACOG guidelines that also recommend that the vaccine not be withheld from pregnant individuals who are agreeable to receive the vaccine. The Department of Health Service is awaiting ACIP guidance about timing of the vaccine in patients who have had COVID-19 infection in the past, but the CDC says, despite the unknowns, survivors may be advised to get vaccinated anyway because of the severe health risks associated with COVID-19 and the fact that reinfection with COVID-19 is possible, although rare. Department of Health Services says even if there's a history of COVID-19 infection, they recommend vaccination, but you might consider waiting 90 days after the infection. Interestingly to me, the side effects of the vaccine were actually less intense for people who've already reported a history of COVID-19 infection. There are no recommendations for antibody testing before receiving the vaccine, and in fact, antibody testing would be useless after the vaccine for determining disease status because the vaccine itself raises antibody titers. Pfizer, that's the only one that has an EUA so far, will conduct post-authorization observational studies to evaluate the association between the Pfizer-BioNTech COVID-19 vaccine and a pre-specified list of adverse events of special interest, along with deaths and hospitalizations and severe COVID-19. The study population should include individuals administered under this EUA, including populations of interest such as healthcare workers, pregnant women, immunocompromised individuals, subpopulations with specific comorbidities, and then the studies should be conducted in large-scale databases with an active comparator. Pfizer will update the protocols and status based on this ongoing research. What that means is that the folks who are getting this vaccine initially, that are getting it under the emergency use authorization, are agreeing to participate in data collection for safety and effectiveness of this vaccine. And active comparator group means that if I have diabetes, and I indicate that on the survey when I received the vaccine, my anonymized information will be compared to an active comparator who doesn't have diabetes so that they can determine if there are any particular risks or effectiveness effects based on certain demographic characteristics. The most common side effects of both vaccines are fever, fatigue, myalgia, and arthralgias. This is generally limited to 2 days after the vaccine, and it's most common after the second dose. It's most common in recipients between ages 18 and 55, less common in older vaccine recipients. The goal is to vaccinate employees on the day before an employee would be anticipating being off shift for 1 to 2 days, so that if the employee gets a fever, they're not precluded from return to work. For nursing home patients, if a fever develops, the CDC recommends that that patient is isolated and that staff use PPE for any symptoms lasting greater than 2 days. Symptoms that are not attributable to this vaccine include cough, dyspnea, loss of taste or smell. You'll recognize those as the cardinal symptoms of COVID-19. Also, sore throat, runny nose were not reported as side effects of these vaccines. The vaccine does not influence the results of antigen or PCR testing. So if you've received the vaccine and you have symptoms that might be COVID-19, you can still be tested in the usual fashion. This vaccine will still be monitored within the VAERS system, the Vaccine Adverse Events Reporting System, and the providers are recommended to report through that standard system. But there's a new app that's called the V-Safe, V-SAFE phone app, which can be downloaded already. That's being supported by the CDC. This phone app will be encouraged for all recipients of the COVID-19 vaccine. And as I understand it, on the vaccine card that you'll receive when you get the vaccine, there will be a unique number. That's your identifier that you put into the phone app. And that number will be associated with your demographic information, but it will be anonymized. And that way, if you have a fever, you can type it into your phone app or whatever other side effect you might have. And that information can be analyzed, real time through the manufacturer and through the CDC. Another website to know about is vaccinefinder.org. That's an already existing website that's used for people to find a location to get a flu shot. Vaccine Finder will also be populated with COVID-19 places, administrative sites. When I looked at this the other day, it seemed that the only sites that were listed for flu shots were pharmacies and retail venues. It didn't list, for example, my clinic that provides flu shots, or Marshfield Medical Center Beaver Dam Hospital, which also provides flu shots. So it looks like it's more consumer based towards pharmacies. The distribution of the vaccine in Wisconsin is under the supervision of the SDMAC, which is the State Disaster Medical Advisory Committee. as of last week, I was told that we would receive 49,000 doses of the Pfizer vaccine. We've already received some of those doses in our state. And assuming the EUA is approved, we're scheduled to get 101,000 doses of the Moderna vaccine by the end of December in Wisconsin. The Pfizer's vaccine is being distributed on a hub and spoke model. What that means is that as of last week, there were 8 hubs designated in Wisconsin, and the vaccine would come to the state. The state Department of Health Services would distribute it to the 8 hubs, and then the hubs would be responsible for their region receiving that vaccine. The vaccine for the Pfizer is shipped in trays of 975 doses. Just yesterday, I read that there are probably more doses per some vials, at least, than what it says. It's supposed to be 5 doses per vial, and some vials provide up to 7 doses. The CDC says go ahead and give them. If you can get 7 full doses out of a vial, go for it. So there might be more than 1,000 doses per tray. It's, as I said before, ultra cold, minus 90 degrees Fahrenheit. What's probably going to happen is it will be thawed at the hub sites and then sent over in a refrigerated form to the distribution locations. It's only good for 5 days once it's thawed. The Moderna vaccine is different. It's going to be distributed by McKesson Medical, and it doesn't go to the state first. It goes directly to the administrators. So there's a vaccinator website through the Department of Health Services and practices that are assigned to the Moderna vaccine through the vaccinator site will receive that vaccine directly through McKesson Medical. The CDC is only releasing the first of the 2 doses. The Moderna vaccine has to be given 4 weeks apart. The Pfizer vaccine has to be given 3 weeks apart. So the CDC says they're going to hold on to the second dose for everybody who receives the first dose and then ship that second dose. That way, hopefully, there won't be a problem with not being able to have an adequate supply to fully vaccinate people. The minimum interval are those 3 weeks and 4 weeks, or 21 days and 28 days. What the Department of Health Services said is that you can give it after that date. Just don't give it before that date because it needs to be at least that minimum interval. The Wisconsin Immunization Registry, the WIR, will forecast when the next dose is due when you type in the information for the patient. And the best practice is to go ahead and schedule that second dose before the patient leaves the facility after receiving their first dose. You'll have to fill out a card certifying that they received the dose. That's the one that has the unique identifier. The follow-up date should be on there, and you need to give them a copy of the emergency use authorization fact sheet. There won't be a VIS, which is the usual form we give folks when they get a vaccine, because this is an emergency use. It doesn't have a vaccine information sheet produced yet. We're rolling out this vaccine in stages. So stage 1A is where we're at now. And that's stage 1A recipients include direct patient care providers and nursing home and long-term care residents. The Wisconsin State Disaster Medical Advisory Committee has a working definition of healthcare personnel or direct care providers as individuals who provide direct patient service, compensated or uncompensated, or engaged in healthcare services that place them into contact with patients who are able to transmit SARS-CoV-2 and or infectious materials containing SARS-CoV-2 virus. After stage 1A will be stage 1B. That's essential workers, which I don't think is yet specifically defined, and assisted living facility and group home residents. Stage 2, as I understand it, will be high-risk adults, and stage 3 would be the general population. There's no specific timeline established for moving from these stages. There are ongoing Department of Health Services webinars, some geared towards providers, some geared towards staff, some geared towards the public. If you go to the DHS website, you'll be able to see all of the upcoming educational and also recorded transcripts of various information that they've produced. That's all I've got for you today. Like I said, I'll try to give you some references and resources. You're welcome to reach me directly and ask me any questions that you have about this talk. But again, keep in mind, I'm just relaying info and I'm really not an expert in this field. Thanks for your time. Have a good day.